Friends, it's Friday afternoon, and we, the Scientific Society of AVMC, are back with another episode of our FFF webinar series, that is Forefront of Future Frontiers, the medical webinar series. And friends, you'll be happy to note that this is episode number 97 on series 15. And this series 15 is discussing trends in medical education. And we have had talks about simulation, evidence-based simulation. And last week we had a very interesting talk. And today we will be having a talk on how to put integration to work and what does the cognitive science, that is the science of learning, tell us. And we have with us Dr. Kadambari, who is the professor of surgery, and she's associated with the NTTC for the last almost 20 years, and who also is my teacher. So I'm very happy to welcome Madam for this particular session. Over to you, Professor Kotur, for welcoming the speaker, and Dr. Bhatt to introduce the speaker.
Yeah, thank you, Professor Mahalakshmi. Indeed, the platform of FFF webinar has got one more crown today, for such an eminent educationist of the country who has been associated with NTTC. He is sharing the platform as a resource person today. And our FFF webinar is heading towards the 100th episode. Professor Kadambari must be happy to learn that. And we have uninterrupted episodes, madam, despite so many hassles, and we have earned the credibility of very wide database across the globe, rather. And I, on behalf of myself and on behalf of my institution, our management, our Honorable Chancellor, Madam Chancellor, extend a very warm welcome to you for this platform. And of course, this platform has been shared by many of your contemporaries, many of the educationists who might be your good friends as well. Okay, as your views today on a very important topic. We always say teaching in art, science is a learning. I like the topic title what you have made, science of learning. Yes, and putting integration to work. Now, this in the new competency-based curriculum, this alignment integration have been a part and parcel of it. Very essential element of this major reform in or much awaited reform in medical education. In every step, they have been there at all levels, and the advantages of this integration, alignment and integration, cannot be denied in the sense it is a what accepted fact. There is no second thought about the obvious advantages of this integrating. What all you can integrate, apart from integrating the subjects, you can integrate the values, integrate the technologies, you can integrate the information communication technologies. See, it is ultimately, you can integrate simple, we are used to integrating video clips, TED Talks, so many things. It is left to the choice of the speaker what all to integrate to make his teaching better, so that learning happens. And we also say that the interdisciplinary, transdisciplinary, multidisciplinary, the symposia, those kind of things also have been going around. That means for the obvious advantage. And I was also told by Professor Mahalakshmi that Madam's thesis was for MHP was this, the integration. That means she must be having in-depth study, in-depth knowledge of this very important topic, which she will be sharing with all of us. And we are always interested in making our learning immersive, integrated, deeper, and we want to encourage the participation of the participants. So these are some of the things, that from today's point of view, where we are in halfway through the implementation of the new curriculum. Her thoughts on this occasion certainly will be of great help to all the teachers who are here on this way. So these are some thoughts, madam, on the process. And now I will be requesting Dr. Bhatt to introduce the Professor Kadambari. Then we will be waiting for your thoughts on the day. Dr. Bhatt.
Yeah. Good afternoon to everybody, respected Dean and our Chancellor, Vice Chancellor and management. On all those, your behalf, I welcome Dr. Kadambari, Professor and Head of the Department of Surgery from JIPMER. She has been our student and she has grown in JIPMER from resident professor. She not only headed the Department of Surgery, but also she was heading the Department of Medical Education. And we are closely working in medical education. And she's a surgeon by profession, and medical education maybe of by interest. She is a FIMER fellow, and she has done a lot of work on breast cancer. Dr. Kadambari's mother was our teacher. She was professor and heading the obstetric department in JIPMER. And I think her mother's skill has come to the daughter, because we used to consider as a great surgeon, and both mother and daughter problem. And there are very few lady surgeons, and she one among them, and she has done a lot of work on breast cancer and uh, early diagnosis, management, etc. She is member of various international organization, International Surgical Society, Breast Surgery International, members of ASI, AVSI, AME, and she's done some research work also, other than guiding the postgraduate students. She has about 51 publications and 3 book chapters. And I'm sure that her knowledge and expertise in medical education will help us understand better. As Dean has said, she has put integration to work, and which is come from the lesson from the science of learning. And I'm sure that after a talk, we will become much wiser. So I will pass on to Dr. Mahalakshmi to continue.
Thank you very much, sir. So before we proceed further, we would like to remind the participants that this program is being telecast live on YouTube, and also we are recording the proceedings for posterior academic use. I request all of you to ensure that your mic is on mute position so that the audio quality is good for everyone. Over to you, madam. You are the presenter now. The stage is yours.
Thank you very much, Dr. Mahalakshmi. Thank you, sir, Professor Kotur, and thank you, sir, Dr. Bhatt, for that kind introduction. As Dr. Kotur pointed out, this is an important topic which is puzzling all of us how to do it. And there's a lot of emphasis, as he very rightly said, in the current CBME curriculum of the MCI. So we do these faculty development programs on behalf of the MCI here as the regional center. And during that discussions which come up about the curriculum, a lot of questions are asked about how to actually integrate and how to support integrated learning. So that actually triggered my interest in the topic. And as I was reading about science of learning, I tried to put 2 and 2 together and came up with some idea, which I hope makes sense to you, because this is primarily the way I look at integration. So thank you, Dr. Mahalakshmi, Dr. Bhatt, and Dr. Kotur for giving me this opportunity to share my views on this topic. And I hope over the next half an hour, I'm able to make sense to you regarding this particular
And you can start sharing, madam.
Yeah. Right. So this is the title of my topic. How do we put integration to work, and what does the science of learning have to tell us about this? So, to begin with a definition of integration, it is derived from the Latin term integrationem, which refers to actually a restoration of wholeness and the entirety. And it's the fact that the whole is more than the sum of its parts. So that is the literal meaning of integration. Now, if you look at medical practice as it is today, a doctor has several roles to fulfill and several tasks to do. They have to diagnose conditions, they have to prescribe treatments, they have to stay updated, they have to communicate with patients, they have to think of service orientations. And so putting all these experiences together, I would say that integration is a core aspect of medical practice. So it is not just in education, but our entire medical practice requires an integration of various skills and knowledge domains. So looking at undergraduate medical education, an undergraduate faces in a traditional subject-based curriculum that we follow in our country. The undergraduate faces content from various subjects. There's so many inputs which come from different sources. There is a huge load of information that they have to face, and they have to make these connections, which will help them to traverse the path of clinical practice, which is a complex path in any case. So before we proceed further, let me ask you a question. As a medical teacher, I'm sure most of you are medical teachers and dealing with undergraduate education. What does the term integration mean to you? You can type your answers in the chat box, and Dr. Mahalakshmi will compile them for me. Dr. Mahalakshmi, can I have a view of the chat box?
Ma'am, you can click it yourself, madam. It is in the right lower corner of your screen.
Okay.
The icon is there. Ma'am, one response is there. Integration means breaking the silos.
Okay, breaking the silos, right?
Yeah, I think others are typing. You can put your responses in the chat box. Dr. Kavita says the topics that are common to all years are integrated.
Okay.
Dr. Madhavan feels that it is implementation for a useful outcome. Dr. Yogesh has come out with a thing that it is holistic learning.
Fine.
Dr. Shri Rekha says it is bridging the gaps. And one more has come, saving time. Integration means.
Okay. Saving time. Okay. I wonder what that means.
Saving time, madam, curricular time, I think. That's what Dr. Kavita means, I think.
Okay. Okay.
Synthesis of learning, that is what Dr. Sunita says.
Okay.
And Dean sir feels that integration happened during our days also without our knowledge. And Dr. Rekha, another person, says it is either system or disease based according to CBME. Quite a lot of responses.
Okay. So we'll go ahead. Actually, it's a mix of responses that of what I expected from all of you. But some of you have given a definition as close to what I'm going to be proposing, or rather what my studies have revealed to me. But some of you have talked about integration between subjects, and which is the commonest thing that comes to our mind when we talk about integration, particularly in undergraduate medical education. So integration would refer to making connections between the various knowledge sources. right? As some of you rightly pointed out, making connections between basic and clinical sciences. Also making connections between factual and experiential knowledge. Ultimately, the aim is for them to understand and perform the professional activities of the medical sciences. So the common understanding of integration is the how to put connections, how to make connections between basic and clinical sciences in the undergraduate curriculum, which is what the curricular designers usually target. So as we understand, basic and clinical sciences need to be integrated or need to be connected for the following purposes. One is basic science help us to understand clinical signs and symptoms, that is, relate clinical features to mechanisms of disease. For diagnostic reasoning, to make diagnosis and to make list of differential diagnosis, and also to solve difficult diagnostic problems. So it is an irrefutable fact that basic science and clinical science need to be connected for developing an understanding of medicine. Another quick question to you, which you can answer as a yes or no. Do clinicians, in your opinion, do clinicians routinely use their knowledge of basic sciences to make a diagnosis? Again, you can post it in the chat box. Just say yes or no. Yes. Okay, there's one response. Yes. Yes, yes, yes.
Yeah.
Okay. A lot of people are saying yes.
Yeah.
Okay.
Ma'am, one nice response is there. They have
Okay.
to.
They have to. Okay. Right. So I would give it a qualified reply, because the answer is actually depending, the answer depends on the, it depends on the level of the learner. If you see novice learners like medical students and interns, they use analytical reasoning to make diagnosis. They consciously connect their knowledge of basic sciences when they analyze clinical signs and symptoms and to arrive at a diagnosis. But if you look at expert clinicians, they resort to non-analytical reasoning. And this occurs because they have encapsulated their knowledge of basic sciences and they have formed what are known as illness scripts in their mind. So these are representations of clinical features. And as their experience increases, they see more and more patients presenting with similar signs and symptoms. They form what are known as illness scripts. So their diagnosis is by a process of what is known as pattern recognition. But there is an exception to this, that even experts resort to their or go back to their knowledge of basic sciences when faced with a difficult or an uncertain diagnostic situation. Okay, right. So the questions that I would like to answer or address rather in this talk are two. So I have divided my talk into two broad areas. The first is to understand what is integration and how it occurs. And the second question is, what are the ways by which integration can be scaffolded? And I'm looking to the science of learning for these answers. Primarily, science of learning is the application of the principles from cognitive psychology to education, that is cognitive psychology or science. And this has made a considerable contribution to our understanding of teaching and learning strategies, how to make them more effective so that we can make recommendations to students to maximize their learning efficiency, right? So let's look at the first question. What is integration? Now, as somebody rightly pointed out in the earlier question in the chat box, integration is primarily a knowledge synthesis. It is a putting together knowledge from disparate contexts and disparate subjects and trying to make sense of it and make connections. So the new knowledge which is gained during learning is also connected with pre-existing or prior knowledge. But what I want to emphasize here is that integration ultimately occurs in the mind of the learner. Okay, so as Professor Kotur asked, we are products of an unintegrated or a traditional curriculum, but we did form integrated connections between the different subjects, and we are not too bad as clinicians either. So integration happens in the mind of the learner, right? So integration can be seen as three things: an educational outcome, which is term integration of learning, which is what we desire. It can be seen as a learning process, how learning occurs by knowledge and memory integration, and it can be seen as a set of educational practices which are practiced to achieve the educational outcome, that is curriculum integration. So I'm going to look at it from these three aspects. So what is integration of learning? Basically, it refers to a higher order learning. That is, a student or a learner moves from basic understanding of a phenomena, basic understanding of facts, to more abstract knowledge and abstract conceptualization. So the learner builds on their knowledge of isolated facts and to look at things in a new and different way. So that is what is integration of learning. And why is it important? Because only if new information is integrated or connected with current knowledge, meaningful learning occurs. And building a domain of knowledge, for example, our knowledge in the domain of medicine as a whole will not happen unless we are able to integrate information that is learned from different contexts, like different times, different phases of the curriculum, and in different places. It could be different areas of learning, for example, the classroom, the laboratory, the clinical bedside, and so many areas, the community. So putting together all these experiences and building a domain of knowledge will not be possible without the ability to integrate. So in medicine, apart from connecting basic science with the clinical sciences, the student also needs to integrate his knowledge which are gained from prior experiences as his learning progresses during the curriculum, their knowledge of self or metacognitive awareness, and another aspect of the curriculum which is gaining importance, that is social knowledge about how to interact with others, that is the communication skills. So all these need to be integrated to provide meaningful learning to an undergraduate. Now, the second aspect of integration, how it happens and what are the learning processes. Looking at integration as a learning process. The first thing is knowledge integration. First concept is knowledge integration. This is required for integration of learning to occur, and it refers to the mental process through which they put together different sorts of information and experience. And we identify relationships and create networks for connecting them. So in undergraduate medical education, knowledge integration, for example, occurs by making connections within and between various subject domains, like the commonly used terms like horizontal and vertical integration. So this is one form of knowledge integration that occurs. So how does integration happen, and what does the science of learning tell us about this process? This is derived from research on how knowledge integration occurs in science learning. So primarily, the first step of acquiring knowledge occurs in the classroom as a result of classroom instruction, where the teacher provides normative ideas, the scientifically accurate information to the students, and these ideas or this information is added to the knowledge of the student, right? And this is available to all students, irrespective of their abilities. Now, from this addition of or accumulation of ideas, they start making connections. But initially, these connections are in a naive way or a non-scientific way, which are called non-normative ways or non-normative ideas. So as a result of which, as learning progresses, there is a mix of normative and non-normative ideas. So they develop multiple contradictory ideas. And with further progression of learning or addition of information or creation of a knowledge base, the non-normative ideas are gradually sorted out and removed, so that finally they are able to productively integrate the new normative or the scientifically accurate ideas with their own experientially supported ideas. And finally, this occurs across topic areas as well. So this is how knowledge integration occurs in the mind of the learner. Now, knowledge integration is not something which is exclusive to higher education. It is seen that even children as young as 4 years of age are able to self-generate new knowledge by putting together their various episodes of learning. And this capacity of the child increases as they age. And by the age of 6, they become less dependent on external support. That is, they are less dependent on the teacher. They are able to independently put together their ideas because their knowledge base expands. They have the faster processing speed as they age, and so on. So what are the prerequisites for integration of knowledge occur? Here, I would argue that first and foremost is the creation of a strong and robust knowledge base, which is required for integration of knowledge to occur. And this in turn is dependent or relies upon a process which is called memory integration. So memory is again central to building a knowledge base. Memory integration, or the process of putting connections within the memory of the learner. Now, before we proceed further, let's see how learning occurs in the mind of the learner. When a learner faces various learning experiences, or even when we face different experiences, these experiences are recorded in our brain in the form of what are known as mental representation by a process called encoding. These representations are further strengthened in the mind, in the brain, by a process which is known as consolidation. And sleep has been found to be a major requirement for this process of consolidation to occur. So these 3 steps in the acquisition of knowledge represent the aspect of storage. Now, beyond storage, but just storing memory or storing knowledge is not sufficient for knowledge to learning to occur. It has to be used. And this process of using the stored knowledge is called retrieval. Now, both storage and retrieval are required for meaningful learning to occur. Right? Now, let's look at the mechanism of storage. How does memory storage occur? You must be familiar with this concept already, so I won't dwell too much on this. Basically, there are 2 major types of stimuli which form the sensory input for our information. One is the visual stimulus and the other is the auditory stimulus. And they are stored, they reach the sensory memory, they are stored in the sensory memory for a very brief, in milliseconds. The sensory memory has a very large capacity, but it has a very, very short duration. So these, the sensory memory is located in the respective cortices, the visual and the auditory cortex. From here, information is taken to the working memory, which is situated in the ventromedial prefrontal cortex. In working memory, information lasts for a few minutes, but the working memory has a limited capacity. It can process only about 5 to 7 ideas or facts at a time. From the working memory, information goes to both the recent memory, by a more robust process, and to some extent weakly also to the long-term memory by the process of encoding. In the recent memory, information is stored for a few days, and from there, by the process of consolidation, it gets stored in the long-term memory, which is situated in the parieto-temporal occipital cortex, or the association cortex. Long-term memory has both implicit and explicit memory. Implicit memory is for tasks which are automatic, like riding a bicycle, for instance. And explicit memory is more for learning facts, or learning from events, which is episodic and semantic memory. Right. But the last step which occurs in the memory reconstruction is the retrieval of memory, where a reverse process occurs and information moves from the long-term memory to the working memory, where it is processed, where it is it interacts with, it is integrated with the incoming new information, and a new memory is stored. And again, it goes back to the recent memory for encoding and then by consolidation to the long-term memory. So new memories are formed in this way. So this explains to a large extent how learning occurs and how a knowledge base is created by the process of memory storage and creation. So what is memory integration? It is basically combination of information which is acquired, or memory which is acquired across separate learning episodes. So this new material is linked to an already existing representation to form a new representation. Right? So it is a central process for knowledge integration to occur. So this will explain to you a little bit about this concept of memory integration. Let's say we are taking a walk and you see a lady walking a dog. So you create a mental representation of this by the formation of neural connections. This is called a neural core, and this is stored in your memory. On another day, you see the same dog, maybe in another situation, you see the same dog being walked this time by a man. Now, in your memory, you have this representation of the lady walking the dog, and now you're seeing the man walking the same dog. So you make the connection between these two events or these two experiences, and you derive the information that this man is somehow connected with this lady. They probably are in a relationship or a husband and whatever. Right? So this is what is called memory integration, putting together new learning experiences with pre-existing information that is stored in memory. So how is it, what is its implication for our medical education? So basically, it depends on the reactivation of prior knowledge during learning of new information. So this results in stronger association. So when we are teaching students clinical signs and symptoms or clinical sciences, if we keep referring back to their knowledge of the basic sciences, it reactivates their knowledge or reactivates their memory of the basic science knowledge, and they are able to make these connections to make it a more robust memory, which is the same thing in the second para. That is, actively reactivating previously learned information is beneficial for subsequent memory. So it reinforces their learning by forming frequent connections with prior learning. The other implication is in clinical learning itself. I'm giving you clinical examples because I'm a clinician. In clinical learning itself, if there is already a pre-existing association, for example, if the learner has seen a certain type of clinical presentation of a particular condition, so he has formed a mental representation in his memory of that condition. Now, when new information comes in of a similar situation, it reactivates the old memory and finds that there is a congruency between the newly learned information and the prior pre-existing information. So learning is strengthened by this. So repeated exposure to information strengthens the pre-existing memory. One more concept in memory research is what is known as, or is being described by, the new theory of disuse. You don't have to worry about this term. Just understand these two terms: storage strength and retrieval strength. Right? So storage strength actually means how well the item has been learned, how well it has been stored in the long-term memory. Now, storage strength has an infinite capacity, and it is never lost. It increases through further study and retrieval. So retrieval strength restores or reinforces storage strength. But retrieval strength is basically the ease with which the item can be accessed. So when there is a queue, for example, you ask a question to a student, it is a queue to retrieve a certain knowledge from the student's memory. So this retrieval strength determines the likelihood of the item being retrieved from memory. But because retrieval occurs in the working memory, and working memory has a limited capacity, retrieval strength is also limited by the capacity of the working memory and the competition which occurs from other inputs to the working memory. Studying and retrieval Both enhance storage and retrieval, but retrieval results in a larger increase. And as we go along, you will understand what implication this has in learning and the creation of a knowledge base. If you remember, I'll say it again. Integration requires the formation of a strong knowledge base. So, coming to the second part of my talk, okay. The first aspect, the first part referred or tried to explain, to look at what integration is and how it occurs and what are the processes that take place when knowledge is being integrated. The second part of my talk is how do we as teachers and the learner himself scaffold this integration process? What are the educational strategies? Primarily, the learner has to implement certain effective learning techniques in order to create a robust knowledge base. And how does the teacher play a role in teaching strategy, assessment, and also by designing the curriculum or making curricular arrangements. Now, coming to learning strategies. There was a question here somewhere. Okay. Can I have a question here? I would like to hear from you in your experience as teachers, as medical teachers of undergraduate. Can you give me some examples of how you have created opportunities for integration in your various subjects? You may be a basic scientist or you may be a clinical scientist. What opportunities have you created for students to develop integration? Can we have some answers in the chat box, please? Using case-based learning, okay. Early clinical exposure. Linker cases, right? Sorry, I didn't get that. When teach them starting from basics, correlate with clinical scenarios, okay. Linking lab science with clinical practice. Any more?
Yeah. Dr. Mahadevan says that degree of dehydration and biochemical changes in childhood diarrhea.
Okay.
Linking lab science with clinical practice, simulation-based education. We have formed focused small group discussion and integrated sessions on topics
Nice.
which have basic science and applied clinical science topics of common interest. Other one we have done is also modular teaching.
Okay. Modular teaching. Okay. Fine. So most of these, if you agree with me, are curricular arrangements, right? The way you design your curriculum, the way you put the learning experiences together for a student, for a learner. So I'm deflecting here a little bit, and I'm, like I argued in the beginning, that learning occurs in, integration occurs in the mind of the learner, right? So the learner is also equally responsible for integrating their learning, integrating the information from different subjects and subject domains. So let's look at some of the learning strategies or effective learning strategies which are directed towards creation of a knowledge base and which improve learning. The first of these is known as elaborative integration, right? Now, this refers to generating an explanation for why a stated fact or concept is true. So asking questions such as, why does it make sense that this thing happens? Why is this particular concept or this idea true? simply asking the question why, and developing explanations for example, how things work. Right? So this is known as a process of elaborative integration, and it enhances learning by supporting the integration of new information with existing prior knowledge. So a strong prior knowledge base is required for elaborative integration. Otherwise, if they don't know the answers for this, they don't have the answers for this, then it may not be a useful technique, and they may actually develop errors in learning if they don't have a prior existing knowledge base. So the presumptive method is that they activate schemata. Basically, they activate these representations of knowledge which are present in the mind of the brain of the learner, which are known as schemata, and this helps them to organize the new information, and that in turn facilitates retrieval. So elaborative integration is more effective, as I said, with a sturdy knowledge base, and irrespective of the learner abilities, even learners with lower abilities can develop this habit of asking themselves why this. For example, a clinical finding or a clinical symptom, why this symptom occurs, and how does this connect to the anatomy or the physiology, right? Or just so learning occurs by generating explanations. That is the elaborative integration. And it's more useful when these prompts or these questions are self-generated rather than the teacher providing the question. And it has been shown in research that even after a delay, when you test them, if they have practiced elaborative integration, the long-term retention and success in the test is much more than compared to students who learn in the simply by using techniques like rereading or rereading study material, or using techniques like underlining and highlighting and all, which have been shown to be not so useful techniques of learning. The second technique, or the second learning technique which is useful, is self-explanation. It's similar to elaborative integration. Basically, it is more useful in problem solving. So the students, it's something like a think aloud protocol, where the student explains their processing, how they are actually developing the solution to a problem. And this, you can have prompts which can be either teacher generated or self-generated, which integrate new with existing knowledge. And for example, explaining what a certain information means to you. And these prompts can be provided as, for example, you give an assignment to a student. You can ask these prompts these types of questions, which will make them integrate their knowledge of new knowledge with their pre-existing knowledge. It requires minimal training. It's not a very effortful exercise. The only problem is it takes a long time for learning. It increases the time that is required for learning. And as you can very well imagine, students want like a magic wand. They want to learn, just like that. So many of them may not be actually willing to accept that these are effective learning techniques. The third technique is what is known as distributed practice or spacing. So as this cartoon shows here, the most common method of learning is cramming. So just before the test, they sit day and night and memorize information, learn, study, and promptly after the exam, they completely forget what is happening. This is particularly true, and I find it all the time when I'm taking clinical case discussions with undergraduates, where they forget all their knowledge of basic sciences when they come to the clinical field. So in contrast to cramming is the process of distributed practice, where learning is spaced. It is a spacing technique, or it is a technique by which it's a scheduling technique by which learning is distributed across time. And this learning can involve restudying the material or retrieving information from memory in a test, or practicing skills. So you give space instead of doing it all at a stretch. You space it out and learn over a period of time. And each time you learn the same information, again, after a gap, it reinforces the memory because the new learning is being processed with the pre-existing knowledge and the memory is being strengthened. So distributed practice or spacing is one of the strongest contributions that cognitive psychology has made to education. Again, the spacing distributes the learning over a period of time, which is not very welcome to students. They prefer cramming. So if you look at it from the aspect of storage strength and retrieval strength, which I mentioned to you earlier, cramming results in a high retrieval strength. As you keep loading information in the working memory, the retrieval strength increases, but the storage strength comes down. So very meaningful learning does not really occur. So when something is very accessible, like you have a high retrieval strength at a particular point in time because you've put in so much information into your memory, but it doesn't get stored. It promptly loses. So retrieval strength diminishes after a period of time and when cramming occurs, and therefore they forget. Diminution of retrieval strength is basically forgetting. So cramming works. Many of us have done it. We have all done this last minute reading and mugging for the exam. So it does work if our goal is to pass the exam. But what we want is long-term retention, which is what spacing results in. So how does spacing, there are some theoretical concepts of spacing. That is, when the second learning opportunity occurs very close to the first learning episode, there is it results in deficient processing. The second way is that it reminds the learner of the previously learned opportunity. And the third is by creating consolidation in the memory of the first trace. So as I said, one of the major challenges is that students may not find it acceptable because they have to do regular studies. And so they need some convincing that it is an efficient technique. But research has shown that spacing has an effect on the final test, which is given after a lag. Now, how much should be the spacing? How much time should be there between periods of study? That is the optimal lag. This is not determined. So it can be a few days, it can be a few weeks. Depends upon the context of learning and when you want to test for retention. The next technique is what is known as interleaving. Interleaving is also similar to spacing, but the difference is that in interleaving, different concepts or different ideas are tackled in a sequence, and it occurs in one study session. So instead of looking at, I've given an example of electrolyte abnormalities. So looking at all problems of which result in, say, for example, sodium abnormalities together, then looking at all problems which cause potassium abnormalities, then calcium abnormalities. Rather than doing it, if you intersperse these problems and learn them in this kind of sequence, A1, B1, C1, B2, C2, A2. So you have a varied sequencing. This results in a varied stimulus. And this resembles more what happens in actual life, right? You don't see all problems with sodium imbalance in one go and then all problems with potassium imbalance. So this resembles what happens in real life situations. So it mimics that, and therefore learning becomes more robust. And interleaving has been shown again by that over a period of time when there is a final test, there is a better performance of students who have who have practiced interleaving. So the difference between spacing and interleaving, you might think interleaving also introduces a spacing because you are giving a gap between topics. It is true, but this is a single study session. In one study session, you can interleave topics, whereas spacing occurs over a period of time. So interleaving, the benefits are said that when you look at repeated examples of the same type, they start losing attention, right? So the mind starts wandering. The other is that by looking at problems which are a little variable, you are able to compare and contrast these exemplars. So that results in encoding of higher order representations. And the retrieval, which occurs with repeated learning, you learn one concept, then learn another concept, then you come back to the first concept, you're retrieving your memory of your previous learning. So that itself improves your storage strength. So this is what this figure shows, that by interleaving and spacing, retrieval strength and storage strength both are restored. The final technique which students can practice is what is known as practice testing. That is, you must have seen many textbooks at the end of the chapters, they have questions for practice, right? So that is one of the ways in which they can utilize or solve these problems. That's one of the ways in which they can practice test or test themselves. And this is one of the more higher utility techniques of learning, which helps because basically it results in retrieval of information. And every time you retrieve information from your memory, learning becomes that much more robust. So this is based on the principle of retrieval enhanced learning. This is a very seminal study on this aspect, where they divided students into actually 4 groups. I have shown only 2 here. The first group did only 4 episodes of study, restudy, restudy, restudy. The final group did 1 episode of study and followed by 3 episodes of testing. In the immediate performance, in these testing performances, they did not do very well because they had only 1 episode of study. But in the final test, they did much better than the students who were exposed to 4 episodes of rereading or restudying the topic. So this is called retrieval enhanced learning, and it has a very strong evidence base. Okay, so my question has come here. We'll move on. So what does a teacher do to scaffold integration? Now, the 2 main aspects, or I would say 2 main strategies that a teacher needs to employ is to tackle a topic at depth. So curricular depth, rather than superficially touching on different topics and having a breadth of topics and a variety of topics, going into the depth of the topic results in a building of a stronger knowledge base and therefore integration of learning. The second is the instructional time, spending adequate time in learning, because learning takes time. It requires the storage of the memory, it requires retrieval of the memory, it requires the formation of a knowledge base. So spending enough time in teaching a topic is also important for developing a strong knowledge base and integration. The third concept is what is known as the introduction of desirable difficulties. The same spacing, interleaving, and practice testing, which we looked at as learner strategies, can also be utilized by the teacher. And these are known as desirable difficulties. So desirable difficulties are basically manipulations of the condition which create for learning, which create difficulties and challenges, right? So they do tend to increase the frequency of errors during the acquisition of knowledge. Okay, but in the long term, there is a definite benefit in terms of retention and also transfer of learning, transferring their learning to newer situations. So desirable difficulty methods include spacing, which can be introduced by the teacher by spacing teaching or learning over a time, by teaching rather than teaching a topic once and revisiting it a few weeks before the exam. Revisiting prior learned topics by giving them assignments. For example, when they're learning clinical medicine, why not give them assignments on basic sciences? And and also looking at what are poorly understood material from previous classes and repeating teaching or learning of those materials again. Interleaving is as a retrieval technique, it is useful for students, but in teaching, it is useful as a concept learning strategy. By giving examples, right? Students learn by looking at differences between these examples, and so they develop a concept of that particular or develop that concept by looking at these examples. So when examples within a category are similar, then interleaving works because they recognize these subtle differences and are able to develop a knowledge base. But when the exemplars are very dissimilar, then blocking is being shown to be superior. Blocking means learning all concepts of one as together, then moving on to the next concept. Now, the other strategy that the teacher is involved in is the assessment. So, for integration to occur, the assessments have to be designed so such that they force the student to make connections between the concepts and principles. So we have to, I'm not going into the details of how to create a question. It is up to us. If we keep these principles in mind, then we'll be able to ask the right kind of questions. I've given an example here. You may ask questions which require explanations. For example, if you ask an MCQ item, you follow it by a constructed response item, like asking them to explain their choice, right? So that can be one technique. And in general, the constructed response, like an essay answer or a short answer, is much more effective in assessing knowledge of knowledge integration compared to MCQs. So basically, assessment is based on the retrieval practice effect or the testing effect. The other term is also, as we saw earlier, test enhanced learning. So what happens during assessment?
Sorry, madam, we are nearing 4 o'clock mark, 3:57.
Oh my goodness, I'm sorry. Okay, I'm
No,
just.
madam, it's okay. We'll park some time for questions. I'm sure we'll have a lot of interesting questions.
I'm sorry. I didn't notice the time. I just have a couple of slides more. Okay. So basically, it's memory retrieval and the cues. The cues are the questions we use, and that is critical to see what to determine what the student can recall. The other are curricular arrangements. We have seen horizontal integration, vertical integration, spiral integration, and all these are being implemented. I'm not going into the details of these. There is also this integration ladder, which we are very familiar with. The top 3 rungs of the ladder refer to an integrated curriculum. So basically, an integrated curriculum refers to breaking subject divisions, like somebody said, breaking silos. So that is what an integrated curriculum is about. But one thing we must remember is simply having these curricular arrangements cannot produce meaningful integration of learning because it has to happen in the mind of the learner. And therefore, what we need is a curriculum where knowledge is slowly expanded and previously learned information is often revisited to make sure that these knowledge networks are strengthened. So the take-home messages are that integration occurs in the mind of the learner. Integration of learning is the desired outcome. Knowledge integration is an automatic process which begins in childhood. Knowledge base is central to integration of learning. Memory integration is required for building the knowledge base. And meaningful learning involves both storage and retrieval. Effective learning techniques increase both storage and retrieval strength. Teaching to promote integration involves curricular depth, instruction time, and desirable difficulties. Assessment scaffold integration by employing retrieval practice, and curricular arrangements by themselves do not result in integration of learning. So with this, I hope that I have helped you to find the final piece of the puzzle of integration. Thank you very much. And I apologize for going over time.
No issues. Thank you very much for that very nice talk, madam. I think the talk covered the basics of integration, starting from what it is, right? Normally, we realize that when we start thinking in depth about any of the factors, there are 2 things. There is actually gaps within our minds and also between us, between different subjects or specialities. That's what we realize when we start in depth looking at it. And then you walked us through slow and fast thinking and critical thinking. How does it occur? Like the neuronal networks and all that, and also the meaningful learning. And then what was very interesting in the whole talk was that how the learners can strategize and how the teachers can strategize how they can build it in. I think those are the concepts which came out very nicely in that particular talk. And one point which you have repeatedly emphasized is something which is something very close to my heart also. Learning unless it is effortful is likely to be very ineffective. So I think that was the very strong message which came out of that particular talk. Before we open the question to the audience, they can put the questions in the chat box. I'll ask Dr. Vishnu Bhatt sir your comments, or if you have any questions for madam.
As you rightly said, it was a very interesting talk. She gone in the depth of the learning process and the integration. One thing is that the in-depth learning, which she was stressing. So with the limited time, sometimes it becomes a problem. Maybe how to, as a research study, we can do some topics, but when you do the whole curriculum, sometimes it becomes a problem. So maybe my question is, we should concentrate more on self-directed learning to make up the timing, because otherwise probably sometimes there may be difficulty in covering.
Yes,
So,
sir.
Dr.
You're
Kadambari.
absolutely right. You're absolutely right, sir. Because one of the sorry, sir. Are you saying something?
Yeah, self-directed learning, because you are concentrating on the in-depth learning in integration. So sometimes the time may be a factor because we have time. And if you have to go to in-depth knowledge, whether they would be able to fit into the available time. So probably we have to stimulate more on self-directed learning. I don't know your opinion.
Yes. As you rightly point out, curricular time is something which is limited for us. But what I'm trying to drive at here is rather than having a breadth of topics, we should focus on conceptual learning. So drive in the most important concepts which are required for creating that knowledge base. That should be the role of the teacher. And the rest of the learning should be on the part of the student. As you rightly pointed out, self-directed learning is one of the terms that is being used now, self-regulated or self-directed learning. But we have to, it's become, shall I say, it has become the required norm now that we have to prod students into going for self-directed learning. We have to keep coaxing them to go and learn on their own. They expect too much from the teachers. And therefore, we find that unless we sort of what we call covering the curriculum, all the topics, we are not happy either. So we feel, oh, we have left out this topic, we have left out that topic. But actually speaking, that may not be always required. So what we need to ensure is conceptual understanding.
What madam wants to say is also the threshold concepts we need to be focusing on the core concepts, and the rest of it is allowing them to do. Our Dean sir is on the line, I think. Sir, would you like to ask any question? I'm seeing you're waiting.
I already put in the chat box that integration happened even during our days when we had not heard of these words also. So I hope Professor Kadambari will agree that is a inborn characteristic of a human being, to integrate the things, the brain assimilated the things in different parts of the time, different parts of the place, etc. And when the need is there for their application, the brain automatically does that. That's what I can say. Now that with the new reform and all, we are giving so much of importance and trying to emphasize, analyze, and classify how it occurs, where it occurs. Of course, I'm not denying that integration ladder or described by eminent people, but without that also the brain is a wonderful thing which does it automatically. What, Professor Kadambari, your views on that?
Yes, sir, I totally agree with you. That is what was my last take-home message, that simply making all these curricular arrangements and having an integrated curriculum, putting subjects together, and particularly what is going on in the West, there's so much emphasis on this kind of an integrated, delivering subject domains in an integrated manner, which per se it may not result in actual integration of learning, which is our ultimate outcome, educational outcome. And as you very rightly mentioned, it happens in the mind of the learner. That's exactly what I'm also saying. And we are all products of a traditional curriculum, and we have been able to integrate because it is an automatic process. The mind naturally integrates information, and that is what I've tried to argue in this talk, that memory and knowledge are core to the development of integration, and it happens automatically.
Thank you, madam.
Thank you, ma'am. Then Dr. Kavita, who is the MEU coordinator of MMC Regional Center, she says it is very interesting talk. It helped her to reflect on what we are doing about scaffolding the students, and she feels that a lot more can be done to integrate and retrieve strongly. And Dr. Mahadevan also has paid his compliments, madam, and he feels that you have taken us through a thoughtful journey through allays of neural network. I think I like the way he has used the phrases. I don't know. And other thing which I would like to, when I was listening to the talk, especially on the memory integration and reactivation, I was just thinking about how the rocks are formed, madam. Like sometimes learning occurs in aha moments, that you get an epiphany, that suddenly it makes connections and you start understanding things. It happens. Sometimes, most of the times, it is like sedimentary rock, no? One layer, one layer, one layer, one layer, it keeps building about. And maybe when sufficient layers build up, or when sufficient input comes, we start actually metamorphosizing also. When we look into the process, actually we think about, or we start reflecting, then there is a basic change in the way we think or the way we approach also. So all three forms of learning is possible, and all three forms of learning can be induced, so that the neural network, what you showed, something similar to our C drive and other drives in the computer, the long-term memory, short-term memory, and retrieval. I think that was the key to understanding of this particular concept. And ma'am, thank you. I would like to thank you very much for giving this very interesting talk, and also taking part in this engaging question and answer session after the talk. This actually made certain very hazy concepts quite clear, and many a times we keep telling a lot of these arguments, but the neural science, especially the what has been made popular by our Make It Stick, the book, has actually made this very clear. I thank you very much for actually this accepting our invitation and then delivering this talk. Thank you, madam.
Thank you. Thank you very much for giving me this opportunity. Thank you.
Thank you.
And for the interest of our learners, we have been asking madam, or we have been hounding her for quite some time. Now only the opportunity came actually for us to listen. And on that note, we'd like to inform the lead participants that next week we have another very interesting thing in trends in medical education. We have modified mini kicks for medical students. This is an experience from AIMS University, Malaysia, Professor K.R. Sethuraman and his Deputy Dean, Dr. Shri Kumar. They will be telling us that how they have modified the mini kicks exercise by incorporating ASCII into the mini kicks exercise to assess the learning students. So that is the talk for next week. I hope that you would be finding time to join us in the next week's talk also. And not to say that the episode number 100 is fast approaching. On July 8th, we have the episode 100. And simulation, the future of healthcare, we have all heard. But future of simulation in healthcare is the talk. And Dr. Vinay Nankani, who is associated with the Center of Simulation in University of Philadelphia, is a pediatric critical care specialist. So he is going to deliver the 100th episode. So stay tuned, and you can watch all our episodes in the YouTube. Thank you very much. I take this. I will close this meeting with this. Thank you. Bye bye.
Thank you. Thank you.
Thank you, madam.